Hello and welcome to GP Notebook TV. My name is Anish Kotecha and I'm a GP in South Wales. Today I thought I'd discuss with you the relatively recent New England Journal of Medicine article that came out discussing either continuation or discontinuation of antidepressants for those patients with depression in primary care. And this was published in September 2021. So as usual, I thought I'd summarise the article and give you some key take-home messages that I feel are important for us in primary care. So really the background for this article was that people with depression that present to primary care are on antidepressants and often they're on them for prolonged periods of time. And this article was really looking at whether there was any differences if we maintain their treatment or actually if we try and discontinue treatment for our patients. And so this looked at a randomized double-blind trial that either looked to continue and maintain treatment for adults with depression or actually discontinue their treatment. And they looked at people on 4 medications in particular. And this was either citalopram 20 milligrams, fluoxetine 20 milligrams, sertraline 100 milligrams, or mirtazapine at 30 milligrams. And they either continue this treatment or, as I say, stopped the treatment for them. Now, in terms of the inclusion criteria, these patients were all adults and they had to have 2 prior depressive episodes and been on antidepressants for at least 2 years, and they had to be stable enough to try and discontinue and happy enough to discontinue their treatment. Now, just out of interest, these medications are very common. We give them all the time to our patients, so it's very generalizable to our populations and the types of people we're seeing in our practice. And those doses were picked because actually they're often the doses that we can maintain people on to keep people relatively stable. Just as a reminder that paroxetine and venlafaxine often do give worse withdrawal symptoms, and so these weren't picked for the study, and it's just a reminder for us in general practice as well. What the study did was looked at these people over a 52-week period and regularly caught up with them via interviews and questionnaires. And the primary outcome they were looking at is time to or episode of first relapse of depression, and that was defined as people feeling depressed or unable to enjoy things for 2 weeks or more. And secondary outcomes that they looked at were any withdrawal symptoms, any worsening symptoms of anxiety and depression, and also their quality of life and their mood ratings as well. Now, some interesting points from the study. The average age of these patients was 54, and the vast majority, actually nearly 3/4 of them, were all female. Now, what they found in this study was that 39% of those that were maintained on their antidepressants had a relapse within that 52-week period, compared to 56% in the arm of discontinuing treatment. So more people who discontinued their treatment had a relapse of their depression. They also in those in the discontinuation group, they also had worsening symptoms of depression and anxiety. Out of interest, 39% of those in the discontinuation arm of the study also went back to their GP and restarted their medication by the end of the trial. And those, again, in the discontinuation arm had a slightly worse adherence rate to the trial as well. So some interesting points there, I feel, from this study. Now, what the co-authors of the article have suggested is that these results cannot be extrapolated to other classes of antidepressants, but also we can't, because there was a lack of ethnic diversity in this study. We can't actually extrapolate these results to non-Caucasian people of a non-Caucasian background. I think that was a little bit interesting to bear in mind as well. So, in summary, what this study and article have suggested is that people that discontinued their antidepressants in primary care are more likely to suffer from a relapse of their depression within a 52-week period, but also have worsening symptoms of anxiety and depression and an inferior quality of life. So it's just something to bear in mind when we're speaking to our patients in primary care with depression, and when we're having that conversation about whether to continue their antidepressants or actually whether they want to try and wean off them, but then having a close follow-up as we wean them off and reduce them if we're going to go down that route. So I hope you found this video useful and thanks for tuning in. Please do continue to tune in to GP Notebook TV for further videos. Thank you.